My name's David Schenker. I'm a doctor here at the Women's Clinic. I've been here since 2008. Today I wanted to talk about actually two procedures that we do here commonly. All of us do them, and the reason I want to talk about them is because I feel like most of my patients don't even know that they exist. And the two things that we are mostly hearing about are really heavy periods. We call that menorrhagia. And the other one is incontinence, or leaking urine later in life. And so these are two problems that we hear often here, but patients aren't aware that we have some pretty simple outpatient procedures that can really be rewarding and beneficial for them. The results are really good for them. So the first one is for heavy periods. It's called an endometrial ablation. Some people may have heard of it or have a friend that's had it done. It's a really quick outpatient procedure. We do it in outpatient surgery. Sometimes we can do it in the clinic. It ranges anywhere in time frame from 90 seconds to 10 minutes. So it's really quick. You do go to sleep for it. That's a common question I get. Am I gonna have to be awake for this? What it's doing is it's destroying, for lack of a better term, the base layer of the lining of the uterus that grows every month and makes a menstrual cycle. So there's literally nothing growing inside the uterus anymore. A lot of people say, well, isn't it natural to have a period, and is that a problem? And it is natural to have a period, but you don't have to have one. And an important point here is this is supposed to be done after childbearing. We don't want to be messing with the lining of the uterus if we're still going to have children. Side effects, they always say, what's the side effects? Well, the side effect is no period. There's no other side effect from it. It does not affect your hormones. That's another question. Are my hormones going to be affected? No, it does nothing to your ovaries or your hormones or anything. So basically you just stop having a heavy period. The second one is a surgery for incontinence or leaking urine. A lot of women come in here and they're kind of embarrassed to bring that subject up, so I always ask it. When they tell me they're having issues with it, and usually it's to a point where you're having to wear a pad every day or something like that, it's very inconvenient for you. And you don't have to really suffer from that as well. There's a procedure we do called a urethral sling or a mini sling. It's about 1 centimeter wide that goes underneath the urethra, and really we're just cinching it up to keep urine in the bladder. And the results on this are very good. I would say upwards of 90% of people become dry and no leaking after this procedure. Both of these procedures, I think I get the most reward from my patients, just because the results are so good that they're so happy they did it. I would say that's the two things that we're doing now that women don't know enough about, that this procedure or these procedures are out there and can help their quality of life.